Clomiphene citrate is a medication used to treat infertility in women. It helps increase the amount of hormones that support the growth and release of a mature egg, which is called ovulation. It should be noted that this medication is not recommended for women whose ovaries no longer make eggs properly, also known as primary pituitary or ovarian failure. The daily dosage varies depending on the individual's condition, and it is important to take clomiphene citrate at the same time each day to maintain a consistent level in the body. Typically, it is best to take this medication in the evening. When taking clomiphene citrate, it's important to follow your doctor's instructions carefully. Take it by mouth as directed and do not take it more often or for a longer time than prescribed. Your dosage will be based on your medical condition and response to therapy. Long-term treatment with this medication is not recommended and should not be more than 6 cycles. You may also be directed to record your body temperature, perform ovulation tests, and properly time sexual intercourse for best results. If you have any questions, be sure to ask your doctor for guidance. Some common side effects of clomiphene citrate include stomach upset, bloating, breast tenderness, and headaches. However, many people using this medication do not experience serious side effects. It's important to tell your doctor if you experience abnormal vaginal bleeding or mental/mood changes. Vision changes may also occur, especially when exposed to bright light, but these usually go away after treatment is stopped. In rare cases, clomiphene citrate may cause a condition called ovarian hyperstimulation syndrome, OHSS, which can lead to fluid buildup in the stomach, chest, and heart area. If you experience severe pain or swelling in the lower abdomen, sudden weight gain, nausea, shortness of breath, or chest pain, seek medical help immediately. Additionally, if you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing, seek medical help right away. Remember to contact your doctor or pharmacist if you notice any other effects not listed above. Before taking clomiphene, make sure to inform your doctor about any allergies you may have. It's important to talk to your doctor about your medical history, especially if you have ovarian cysts, liver disease, or thyroid problems. Clomiphene may increase the chance of multiple births, so consult your doctor for more information. This medication may cause dizziness or vision changes, so avoid driving or using heavy machinery until you can do so safely. It's important to stop using this medication if you become pregnant, as it should not be used during pregnancy. Consult your doctor before breastfeeding while using clomiphene. When taking clomiphene citrate, it's important to be aware of potential drug interactions. Certain medications or herbal products can affect how clomiphene citrate works or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with clomiphene citrate is gonadorelin. Be sure to discuss any concerns about drug interactions with your healthcare provider. If you or someone else has taken too much clomiphene citrate and is experiencing severe symptoms such as fainting or difficulty breathing, it is important to seek immediate medical help by calling 911 or a poison control center. In the U.S., you can reach the local poison control center at 1-800-222-1222. Canadian residents can contact their provincial poison control center. Symptoms of an overdose may include vomiting, abdominal or pelvic pain, and vision problems. Remember, this medication is for your use only, so don't share it with others. Your doctor may also want to do some tests while you're taking clomiphene citrate, like checking your hormone levels or doing a pelvic examination or ultrasound. It's important to keep all your medical and lab appointments, so make sure to consult your doctor for more details. If you happen to miss a dose, it's important to contact your doctor right away for further instructions. It's not recommended to take a double dose to make up for the missed one unless your doctor specifically instructs you to do so. It's important to store clomiphene citrate at room temperature, away from light and moisture. Keep it out of the bathroom and in a place where children and pets can't reach it. When you no longer need the medication or it has expired, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. And remember, never flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.